Bismillahirrahmanirrahim. Assalamualaikum and a very good afternoon. So welcome everyone to this quarterly SIG clinical toxinology webinar. So for today, we're going to present on approach to jellyfish stings. Okay, before we start, I would like to just introduce our expert panelists and also our speaker. Okay. Before we introduce the speaker, the two expert panelists that will be with us today, number one is Dr. Muhammad Zaki bin Senek. He is a consultant emergency physician at Hospital Sultanah Nur Zahirah, Kuala Terengganu. So he completed his Master of Medicine, Emergency Medicine in USM in 2011. And he has also completed the subspecialty training program in the pre-hospital care and disaster medicine under Ministry of Health Malaysia in 2019. Currently, he is the head of pre-hospital care unit of HSNZ Kuala Terengganu. He has special interest in pre-hospital care services, disaster medicine, wilderness medicine, and clinical toxinology. Okay, so welcome Dr. Zaki. The second expert panelist who will be also with us today is Dr. Yvonne Teo. She is currently the emergency physician and head of department hospital Duchess of Kent, Sandakan, Sabah. So she completed her masters in emergency medicine also in USM in 2016, and she is also one of the REX remote environment consultancy services consultant since 2018. She also has a deep interest in clinical toxinology. All right. So, and last but not least, our speaker for today. Welcome Dr. Muhammad Naim bin Abdul Razak. Okay. He is currently a very famous prolific writer and a very senior registrar in emergency medicine hospital Had Datu. He obtained his medical degree in 2011 under University Science Malaysia, and he also obtained the membership by examination under Royal College of Emergency Medicine UK in 2021. And last year he just completed his fellowship of emergency medicine under Royal College of Emergency Medicine UK 2023. He has great interest in wilderness and extreme medicine and also clinical toxinology. He is the founder of Wilderness EMS Sabah team in 2015, and well as co-founder of Wilderness and Austere Medicine Society of Malaysia in 2019. And apart from clinical toxinology, he is also a member of Wilderness Medicine SIG College of Emergency Medicine, Emergency Physician Malaysia. So as for now, he also obtained a fellowship in Academy of Wilderness Medicine in 2023. So without further ado, I would like to invite our speaker for today, Dr. Muhammad Naim, to present his topic. Dr. Naim, up to you.
Right. A very good afternoon to all of you. Thank you, Dr. Anas, for the very kind introduction. Welcome to all the participants as well as our consultants who are on the floor today. So I hope that my voice is loud and clear and my slide is clear. Right. So today my talk will be on the approach to the jellyfish sting and envenomation. So already introduced me. I came from the Sabah, so I just would like to take this opportunity to actually promote Sabah. If there is a new MO or any houseman who's graduating soon, please do come to the Sabah, especially if you love to do the outdoor activities. So basically in Sabah, you can do everything from the bottom of the sea to the top of the mountain, and there's a lot of things that is very exciting, and even in managing the patient also, it's very interesting. So I think we have about 50 people joining the discussion now. But let me just give some time if others would like to join. By just while waiting for them, let me just show some of the clips that based on my previous diving activities, just to kind of like warm up our floor today. All right, let's get to the business. So today we are going to talk about jellyfish sting and envenomation. So basically, jellyfish they are under the phylum of Cnidaria. So it has over 11,000 of species. Basically, from the main classes include the Entozoa, Tubozoa, Hydrozoa, and also Scyphozoa. And based on the latest studies, there are about 100 species of them are known to be harmful to humans. And it is estimated that 150 million cases of jellyfish stings occur per year globally, with 20 to 50 deaths, particularly following heterotropic box jellyfish envenoming. The numbers of deaths look quite small, but I think that this could be due to underreporting as well because of few other factors. Right. Yeah, surprisingly, when people say that jellyfish is dangerous, the only thing that I can imagine about them is how delicious the salad is. And it even been sold as some trips and foods. So, but now we are going to put the food aside and we are going to talk about the jellyfish envenomation. So basically, my interest in jellyfish started when I had a case of a child being stung by jellyfish back in 2015, 2016. But at that time, we had no ideas regarding the species that stung the patient. And throughout the years, we even had some mortality cases that been reported to the REC. So since that we've been working closely with other members, especially the REC, the MSC, and also UMF, until that recently we found few species that is able to cause death in humans that occurs in Sabah. So basically, why we start doing this is that there are actually many unverified reports regarding children from the various states of Sabah being stung by unidentified jellyfish and died. But most of the victims were not brought to the hospital and the event were not documented. So based on my interviews with some villagers, they did mention about how they just like when there's a death occur, they just like kind of bury the patient, so not postmortem done. So we cannot really verify the report. And some of the deaths have been reported in the newspapers, especially the famous one would be the cases of 8 years old boy who died in 2006 in the Pulau Sapi, as well as the late Japanese boy who died in Kota Belud in 2012. So the reason why people are not really know about these things that because jellyfish sting incidents are not classified as mandatory notifiable disease. With that, we could not really estimate the true burden of this problem. And not only in Sabah, but as in Malaysia as a whole, research related to jellyfish stings are still undergoing. Not much of the thing that has been reported yet. So far, based on what we gather from 2006 to 2022, there are about 6 reported deaths from the box jellyfish sting in Sabah. And based on literature review, at least 18 deaths has been recorded from jellyfish sting in Malaysia until 2022. But there is some problem with the data that cannot be verified whether it is the repetition of the cases that we reported or it is actually a new case because of the problem that I have mentioned before. But the numbers could be more actually. So what we observe from the series of deaths that occur in Sabah, some of the things that we think can be modified is that a few things. One is that there is no early preventive measure, especially during the time of jellyfish blooming. So people don't actually like kind of warn people to stay out of water or even bring vinegar to the beach or even to put the safety net at the touristing area. And the second reason would be the failure to recognize the cardiopulmonary arrest and providing early CPR. And most of the cases, they are not even activating the 999 system. And the other thing would be the inappropriate health-seeking behavior. And of course, there are some other reasons, including the distance to the hospital and the issue with the nationality, education, as well as the financial constraint. Managing jellyfish stings in Sabah is quite challenging. The first issue that we had earlier on is the exact jellyfish ID as well as early diagnosis. But I think half of the problems have been resolved because we are able to identify some of the venomous species in Sabah. The next thing would be data. Then it's the antivenom stock. Last one, only hospital Lika storing the antivenom. After that, we seem to have more cases in the east coast of Sabah. So currently, we have Hospital Lahadatu and Hospital Tawau also keeping the antivenom. But the stock is not much. Currently, my hospital, we have like 3 vials of antivenom on floor. The next is, of course, I think this occurred to other parts of Malaysia as well in terms of facilities and also the equipment. And the challenge more towards the social demographic factors, especially with the issues of the stateless, illegal immigrants. If you notice at the pictures, the bottom of the picture is actually the house of the sea gypsy people. So basically they live on the boat or they build some temporary shelter on the water house. So sometimes the place they are living are being inhabited by the box jellyfish. So that's why sometimes they are more prone to get injuries from the jellyfish stings. Right. So this is just a picture of some efforts where our work begin from 2015 throughout the collaboration between the REX and also the MSC. We had our first cases of severe box jellyfish sting at that time who presented to Hospital Kuna, in which that the child required the intubation. And throughout the coordination, we managed to transfer the patient to a tertiary hospital center. And from that, we kind of like initiate some initiative to expand the research on the jellyfish stings in Sabah. So I'm just showing some pictures of things that we do, like sampling for the jellyfish and analyze the nematocysts and get the identification. Right. So just let me introduce you to this picture. It looks a bit crowded. So basically, what we are talking about the Cnidaria phylum, right? So under the Cnidaria phylum, we call it Cnidaria because they are the stinging cell that we call a cnidocyte. So personally, I think that jellyfish sting, the diagnosis is a bit misnomer because it is actually referring to the Cnidaria. So for the Cnidaria, sorry, just let me get some pointers. So from the Cnidaria, we actually divided into what we call a sessile and also the meduzoa. So the sessile one is organism that has the cnidocyte but it can't move. So this is especially the coral group. So for the Cnidaria, so we basically divided into the 4 big groups, which is the Staurozoa or the branch jellyfish, the Hydrozoa or those organisms who have the hydrozoid. Cubozoa is the box jellyfish, and the last one is the true jellyfish or what we call as the Scyphozoa. So I think sometimes we refer Portuguese man-owa as a jellyfish, but in reality, they are actually the cousin of the jellyfish. But maybe just for the sake of sharing the knowledge and everything, we just lump everything as the jellyfish thing. But honestly, I think that the classification is important because in terms of management, especially the first aid and everything, different classes of this Cnidaria, they have a different approach for the first aid management, in which that I will explain to you later. Right. So in Sabah, we basically have 17 jellyfish species that has been identified, and 8 of them are known to be harmful to humans. And basically, some of the species they share some similarity with the Semenanjung as well. So I'm going to share the next slide with you. All right. So the first one for box jellyfish, we basically divide them into 2 groups, which is the chirodropid. Chirodropid means that box jellyfish they have 4 corner. So each corner they have their tentacles. They have many tentacles at each corner of their side of the body. So and it's a box because the shape is box. So far we have identified 2 box species of jellyfish in Malaysia. So in Penang, we identified them as Chiropsoidus butadinki. Meanwhile, in the Sabah, we identified them as Chironex yamaguchi. However, based on some pictures taken by the visitors, we do believe that there is also a Chironex species in Langkawi. And it's kind of interesting because if you look at the cases of death compared between the Semenanjung Malaysia and also the Sabah, the death cases that occur in Langkawi and also Langkawi and Pulau Pangkor, even the adults who are also healthy also died following the jellyfish sting. So we postulate that there might be even a more venomous box jellyfish there in the water. The next is we go to, sorry, my slide is haywire, but the next thing is box jellyfish, the carrot-dike or the single tentacle box jellyfish. So far, the jellyfish that we have been identified that occur alongside the Kuantan coastal area is the Mobaka virulenta. And for the Sabah species and also in the Klang Strait, we still haven't found the exact ID. So we just put it as a Mobaka HP. And the third group is the true jellyfish or Typhozoan. This group has the vast numbers of species, but among the species that cause particularly significant sting to humans include the lionman jellyfish. Number 2 is the Yocarsora chinensis. The third one is Linuche aquila, and the fourth is Labonomyces robustus. And finally, for the hydrozoa, most of the things are due to the Physalia physalis. And in last few years, we have this outbreak of Valella. I think it's in Terengganu at that time, but there were no reported significant cause of envenomation. If you are interested to learn more about the jellyfish species in Malaysia, you can actually refer to our works on field guide to the jellyfish of Western Pacific countries. It's available online and free of charge. All right. So the list of the jellyfish in Malaysia is actually growing and yet to be discovered. All right. So let's go to the envenomation part and see how actually the venom apparatus. So if we look at the jellyfish, it has a 2 main parts. The upper part is the bell, quite safe if you touch them, but the other part is a tentacle. So just imagine why box jellyfish is more venomous is because it has so many tentacles and the tentacles are so long. So each tentacle, they have millions of needle sites or the stinging cells. So this stinging cell, needle site, when the tentacle attach to the human body, basically any mechanical stimuli, they can cause rupture of the needle site to release the nematocyst as well as the barbed wire from the nematocyst. So basically the discharged nematocyst, it has like a cap that keep the tubular coil and also the venom inside the body. So just let me share you the video of how the release of nematocysts occur in the from the tentacles. Right. So jellyfish venom is a bit more complex, but the problem is that the research with regard to the jellyfish venom is not extensive as the snake venom. But the most things that we can gather from the literature so far, it contains some potent proteinaceous sporins that are able to cause spore formation. So basically, we identified them as a jellyfish toxin. So there are also other things that include the neurotoxic peptides, bioactive lipids, small molecules enzymes, and some tubules also may contain the ancient collagens, glycoproteins, and polysaccharides. Another problem with the venom composition is that it the venom compounds from one species to one species might be differ. Even interspecies itself might differ because it also may be influenced by the um, variation due to the feeding behavior, the ontogenic shift, the geographical factors, environmental, as well as the other factors. But to summarize, the more things that we are quite concerned with is the ability of the venom to cause the membrane pore formation. And this membrane pore formation venom, especially from the box jellyfish, it is quite specific to your heart and also your lung tissue. So that's why you may get a full-blown ARDS following the envenomation. So toxicity, dermal toxicity, myotoxicity, neurotoxicity, and etc. And interestingly, it may also trigger the immune system to cause various allergic reactions as well as triggering the inflammatory and also the cytokine release. So yeah, I think this is basically just the same thing that I explained just now. Right. The thing is that I personally think that in order to improve our care for patients with the jellyfish sting, we need to make a correct diagnosis first. So what I presented here is what we suggested when you are dealing with the jellyfish sting, the diagnosis should be, for example, if you are able to identify the jellyfish, it should be the identified jellyfish sting, followed with the name of the species. And to quantify the severity of the sting, we may use the total body surface area as estimation to look at how many percentage of body that was stung by the jellyfish. Of course, that it is not being verified or validated, but it is kind of like can give you a rough idea. So the higher total body surface area involved, the chances for a serious envenomation to occur is more likely. And then it's followed by any envenoming syndrome that you might have. And the problem with the jellyfish sting, sometimes it's quite impossible for the victims to bring the jellyfish to the hospital. So most of the time, we may put the diagnosis as an unidentified jellyfish sting, but we can possibly guess the class of jellyfish that involved, especially like the box jellyfish. They can have like some pathognomonic to suggest the sting by that species, in which that I will share later. And sometimes the sting may be due to the unidentified marine animal injury or unidentified marine injuries. Right. So in order to make a correct diagnosis, you need to look at the various factors. The first one is based on your clinical presentation. What are the syndromic or the envenoming feature that the patient has? We can look at the tentacle large mark imprint on the skin. Another particular valuable things that we can do is actually the nematocyst skin sampling, in which that I will explain later. The next one is whether there is any available photo or video of the jellyfish species. And the last thing is that the knowledge on the endemic jellyfish species. So we really need to work closely with our marine biologist friend or perikanan to know what species that are available in our coastal area. Right. So some of the histories that is important for you to take is that the first one is when. When did the jellyfish sting? Of the time, because of few reasons. First of all, sometimes the jellyfish is also associated with the blooming in which the jellyfish occur in abundance. and it helps us to kind of like get some data on when it is happened, and maybe we can like live with our perikanan friend to know what are the species that bloom during that time. And then it also is kind of like associated with other factors like the direction of the wind, the monsoon, and also like in Sabah, the box jellyfish will be abundant when there is the small shrimp, the same shrimp that they used to make cenchaluk thing or udang geragau. Right, and the next thing is when the time of pain or the symptom develop, so that we can actually use that time to estimate uh, because different species they have like a different things. For example, like if you look at the box jellyfish things, the pain will develop immediately for the multi-tentacle box jellyfish and become constant and severe throughout the day. But for the species like the single tentacle box jellyfish, they may have less just a simple sting initially, but pain enough to make them go out of the water, but the pain might be subside. But after like 4 or 6 hours, then they will have another very bad, severe back muscle pain. So that's some of the history that can actually help us in determine the syndrome. And then number two is also the geolocation. As I mentioned, help us to identify the most probable jellyfish that sting patient. Of course, the next one is the stung area, which part of the body that being stung by the jellyfish. Because different part of the skin, we have a different thickness. For example, like if you are being stung on your palm, or so the skin there is very thick, so the chances for the venom to get into your body is slightly lesser. But if it is occur in the area that have the more thinner skin, so the envenomation might be more pronounced. And of course, how, especially the detailed event of how jellyfish thing occurs. But if you have any case of patients come to your emergency department, you need to keep your mind open because sometimes the thing might not be due to jellyfish itself, and you need to consider the possibility of other things. For example, like other marine animal or any aquatic scuba diving injuries. Sometimes can cause to a box jellyfish thing. And the next one is what has been done to the stung part. So like in Sabah, they have some funny things like put the ashes or even put the tea and everything to the stung part. So this kind of like cause more venom to be released in the body, or it might interfere with our interpretation of the clinical syndrome. And other treatments, especially the traditional treatments that are being given to the patient. And of course, some patients may eat or to health clinic before arrive to your emergency department. We kind of like to know what are the treatments that being given to the patient. And of course, although anaphylaxis is not common in the jellyfish, we also need to find that the patient is high risk of developing anaphylaxis. Okay, right. So we move to the general symptoms. So patient might have the nausea and vomiting, the malaise, abdominal pain, and some of them may have the impending doom. So pain is the commonest symptoms following the jellyfish stings and vary according to species. To show some video to show how severe the pain is. All right. Okay, on the next video, I just want you to closely look at the limbs. Right. Certain videos, the child is obviously in writhing because of the pain, but we notice that left limb kind of like moving in the cyclical pattern. So this is something that we cannot say for sure whether it is the movement is because of the severe pain or there is something that cause like local seizure or any neuroexcitation syndrome. Because neuro manifestation in box jellyfish is not being well documented, so like we still like keeping an eye or looking for more cases to compare whether this might actually can be due to the some neuro citation following the box jellyfish stings. Right. So next, just to share with you the skin lesion in the jellyfish sting. So what we have here is from the Chironex. So the first picture that you see now, you can see that of bit less that is in the body. So, and if you look closely at the wound, it's kind of resembling the shoelace. This is a very typical of Chironex but you need to remember well that although that you did not see this kind of pattern, you cannot rule out chronic things. For example, like if you have the pictures on the middle and on the right hand side, there is just some erythema, some look like some urticaria rash there. This is actually jellyfish sting as well, but the things is only at the small area, and somehow it triggers this reaction to this patient. Best thing to when box or non-box take the nematocyst in sampling. All right. So the cytotoxic effect from the jellyfish sting may cause swelling, tissue necrosis, and may predispose secondary infection. So if it occurs at certain parts that are sensitive to swelling, especially in the small children.
Right. So the cytotoxic effect may occur at the same area that are sensitive to swelling, like your genital area in pediatric patient, in which that consultation can actually help you to guide with your management. And some of the patients, they may present late in seeking treatments. So if you look at the pictures, it may cause severe swelling to the face, in which that you need to carefully analyze for the any airway obstructions. And of course, a patient may come with a secondary infection in which the skin may become very swollen with some bullae formations. And the last pictures with the arrows actually just to show you that the area has been tempered with the ashes. So when we do the analysis, so it can cause like the wounds look a bit difficult to see. So if you see this kind of thing, it's better to clean up the area so that we can have a clear ideas of what the wound look like. And certain jellyfish stings, for example, like the box jellyfish, especially the Chironex, they have a very long nematocyst that can deposit in the epidermis for quite some time, and can induce the things can cause the chronic dermatitis in the long times. So it may even present at few months after the event, and sometimes that need to consult the dermatology for this patient. So that's why for the patient with the jellyfish stings, especially the box, so you can, if they are well, you can actually discharge them with the primary care for them to monitor whether there's a worsening of the dermatitis in the patients. Right, just to highlight you some differences for the patient, this one is from the carrot-dyed box jellyfish. If you look at the first picture, there's a very clear fine line for the patient. It looks a straight line, but there is not much lines. So most likely it is not from the multi-tentacle box jellyfish. And compared to the previous picture that I show you, the line kind of like look more fade, not intense as the multi-tentacle box jellyfish. So this kind of tentacle lash marks are more common in patients who have been stung by the carrot-dyed box jellyfish. And of course, some patients may have these nodular papular rash eruptions following the thimble jellyfish stings. And the first pictures here is a tentacle mark from the Physalia physalis stings. You can see that there's a long single tentacle here. And the second picture is a sting from the bigger jellyfish species, which is from the Lebanomites. So you can see that there's a lot of tentacle that is a more smaller in size, less red compared to the multi-tentacles, but is occur in abundance. So based on this size, we can actually estimate that this is a big jellyfish that stung the patient. And of course, most of the times we could not identify the species that bite the stings. Like in these pictures, the stings look like not typical of box jellyfish stings. It could be due to other species, but it requires further evaluations. And of course, you need to carefully examine the skin lesion for any patient who presented with suspected marine animal injury because it might be due to other things. Like for example, like the first picture is because of the sea urchin. The second picture is actually unidentified marine injuries. So we are not sure whether it is because of the stonefish or any things like corals, but we cannot comment because there is no evidence of nematocysts being retrieved. The big picture in the middle is by the unidentified stings. It looked like a tentacle, tentacle lashes mark, but when we analyzed the nematocysts, we could not obtain any nematocysts. So that's why we just put it as an unidentified stings. Right. Okay, syndromic envenomation has been described. There are a few of them that I will share some of it. So the first one is a systemic envenoming following the box jellyfish stings. Then we have the irukandji, the rhabdomyolysis, vascular insufficiencies, and the new term, this one is coined by Prof. Khaldun, is a mixed envenoming syndromes. And we also have like some allergy or the allergic lights. So like you see in these pictures, this is unidentified jellyfish stings that occur in Batu Fringi, Penang, in which that patient developed was a spasm of the arterial spasm causing the peripheral cyanosis. So, but we think that this patient might be stung by the sea nettles or Carsora, because Carsora is one of the box jellyfish sting that is able to cause vasospasm of the vessel as well as neuro symptoms. So this might need to be referred to a vascular surgeon because there might be a role of giving iloprost or hyperbaric therapy. And of course, in some patients like this case, looking at the area of the skin that has been inflicted, so it kind of looked like some big jellyfish that has caused the envenoming of this patient, and this patient have severe rhabdomyolysis causing multiple organ failure and also death. But we are unable to ascertain the type of jellyfish, but I'm suspecting that it might be due to a lionman jellyfish. Actually, the rhabdomyolysis is quite common. It's not a common occurrence, but for me, I think it's perhaps because of underreporting. So for every jellyfish sting, usually it's very quite normal for you to see that the CK is slightly raised. But in certain species, it can cause a massive rhabdomyolysis, or perhaps it might also because of the host are actually susceptible to develop rhabdomyolysis. So we could not establish the link for certain, but it has been reported to occur in the Malaysian water. And of course, this is the pictures of the our previous patient who being stung by the box jellyfish, developed a full-blown non-cardiogenic APO. The things about jellyfish sting, especially box jellyfish sting in pediatric patients, is that you need to be very carefully monitoring them. So based on the things that we have, even the sting of less than 4% total body surface area can actually able to inflict the ARDS. And some patients, they are quite well or slightly having pain only in the emergency department, but after 2 or 4 hours, they start to deteriorate and have respiratory breathing difficulties. And of course, the next is irukandji. So I don't want to go into detail because we are running out of time. But the hallmark is basically a severe pain, including muscular pain that is associated with the catecholamine excess, sympathetic, and also parasympathetic involvement. So as a result, life-threatening cardiac failure might develop. All right. So last time we used to differentiate the species because irukandji syndrome is associated by the original species, is a Carukia banasi, but later it is found that Malokingi is also able to cause the syndrome. So any jellyfish sting that have kind of like irukandji syndrome, but not because of the original species, we tend to name them as a Irukandji-like syndrome. But then, from the latest evidence, it is found out that up to 25 species of the jellyfish can cause this syndrome. Therefore, I think that it is okay to actually to put the diagnosis as a Irukandji syndrome if it is indicated. And all right, so next we go to some investigations. For me, for patients who are stable or having mild symptoms, basically you do not need to take any investigation, just a brief period of observation and you can discharge the patient. But for a significant or severe jellyfish stings, especially if it is occur in a pediatric patient or older patient or those with comorbids. So you need to take some investigation, but it is based on your clinical judgment. So basically, not all patient needs investigation under the skies, but it should be tailored to your presentation. But be in mind that jellyfish sting can cause injury to various organs. So it should be specific based on the case that you're dealing. So it should be a case-to-case basis. And another thing that I want to introduce you here is actually the nematocyst skin sampling that can actually help us to identify the species responsible for the stings. So basically, let me take the pointer first. All right. So like this, my pointer is showing here, you can have a lot of tentacles here. So what you need is actually a clear sellotape. So you need to kind of like stick the clear sellotape on the tentacle lashes mark, kind of put some pressure on that area. So you just need to transfer the film onto the BFMP slides. To increase the sensitivity, please take at least 5 to 6 specimens from different regions of stung area so that you have more luck in finding the nematocyst. So for the sampling, you can actually send to us or Rex. Also, if you are in Sabah, you can actually send to me as well. But we can also like guide you if you consult to the Rex. You can actually examine the slide under microscope to determine the presence of the nematocyst. So first, you need to do a 10 times magnifications. So what you can see here, like the band here is just the remnants of the tentacles. So you just magnify into the 40 times magnification, then you will start to see the nematocyst. So you can take photos. If the microscope is not connected to the laptop, just you can zoom it into 2.5 times magnification and take a shot of it. Then you can have a very nice clear picture of the nematocyst, in which that you can consult any Rex consultant that we can aid you in managing the patients. Right. So I think I don't have much time, but basically the treatments, I would recommend you to consult the Rex early. And for the patient with the severe jellyfish stings, patient need early critical care directed therapy. Especially you need to anticipate that patient might need the ventilation support or the ICU admissions. For the first aid, this is a bit controversial because there's a lot of issues. I don't want to elaborate in the details, but what we recommend is to use vinegar or lidocaine spray to basically deactivate the nematocyst. But if you think that it is because of Physalia, so you can use the hot water immersions using the temperature of 42 to 43 degrees Celsius. More details on the first aid for the jellyfish stings, you can refer to our guidelines, the general management guide for the harmful jellyfish stings. So basically, we have created this algorithm modified from the Prof. Julian White to help you actually treat the jellyfish stings. But this sounds like a little bit crowded, so I do not have time to explain more on this. But I will give you reference at the end of the lectures. Box jellyfish antivenom is something controversial. Personally, I think that supporting the ventilation and also hemodynamic is much more important. But if you have the box jellyfish antivenom in your store and you think that the sting is because of the chirodropic box jellyfish, especially the chironex species, then you can use it if there is an indication. So if there is a life-threatening cardiac or respiratory decomposition, you can give 1 to 3 vials. If there is a cardiac arrest, you can give 6 vials. So other indication like cardiac failure, arrhythmia, patient is unconscious, or severe pain unresponsive to opioid, you can give like 1 vial as well. For Irukandji syndrome, you need to aggressively treat the pain as well as you need to bring down the BP and also heart rate. Some of the treatments suggested here might not really work for all the patients, like the magnesium sulfate, everything. There is not much data to show its efficacy, but most of the time it is derived based on the case report. But if you do have like problems in managing the patient, you can always like consult Rex at any time. So other things include the topical creams or steroid and antihistamine. This one is based on clinical judgment, because if you think that the symptom is more predominant on the allergic light, you can actually start the antihistamine, but you need to be careful with the steroid as well, because it can like increase risk of secondary bacterial infection. So need to like tailor-made your management according to the patients. For the antibiotics, you need to look at the wounds and also the risk factor, because sometimes patient with the jellyfish sting can have a secondary marine infection. So if you start the patient on the normal antibiotic like augmentin, it did not cover the other species of marine infection. So maybe you need to add on the other agents like third generation cephalosporin or doxycycline, in which that you can always discuss. So vascular insufficiency, as I mentioned before, need to refer to vascular. So there are various modalities of treatment that being suggested. None show the superiority, but the data are too small. But patient might need the ileoprost hyperbaric oxygen therapy or endomolecular heparins. And the last one is actually your monitorings. Actually, this is available from in the research kit, or you can scan these things later. This is just a guide for the jellyfish stings. So it is not being undergone any review yet, but at least it can give you some ideas on managing the jellyfish stings. All right, I think that's all my slide. So I give the session back to the Dr. Anas, and I'm okay to accept some of the questions if you have. Right.
Okay, thank you very much, Dr. Naim. Wow, so enlightening and very informative presentations. For those of you who just joined in between the sessions, welcome to our clinical toxicology webinar. So with us today is also Dr. Yvonne from Hospital Sandakan and Dr. Muhammad Zaki from Hospital Sultanah Nur Zahirah as our expert panelists. And also we have also Prof. Khaldun, Dr. Zainal, and other some REX consultant with us. Okay, so Dr. Naim, we have some questions posted in the chat box.
Right.
Are you ready to accept one question, Dr. Naim?
Yes, sure.
Okay, so question number one being asked from I think Peninsula MO. They want to know where else do we keep antivenoms apart from Sabah? Do Semenanjung have antivenom?
So far the only place
jellyfish
that,
antivenom. Yeah.
so the only place that store antivenom is actually in Sabah. In Semenanjung there is no antivenom being stored yet, but I think following the death cases from the Pulau Pangkor, I think Dr. Ruth Sabrina has go there and when there maybe discuss whether the possibilities to keep the antivenom or not. But so far as I'm concerned, we have not yet to store any antivenom in Semenanjung, Malaysia.
Okay, so for your info, there is not yet antivenom in other states apart from Sabah. Hopefully soon we'll get to store some of the antivenoms. Okay, as we know, we are getting more and more number of cases being stung by jellyfish, especially in Penang, nearby area that I'm working on today. So, all right, talking about Penang, one of the participant asked about what are the common type of jellyfish, common species of jellyfish usually found in Penang.
Yes.
And the second question, whether Penang have antivenom, already been answered by Dr. Naim.
Right. For Penang, as I mentioned in my presentation earlier, there is a box jellyfish there which identified as Chiroxodus butijinki. But based on the picture taken by some visitors, I do believe that there's a Chironex species there, but we are yet to identify the exact species there. So for the other skyphozoan jellyfish like the Cyanea species or the Lyomans, the sea nettles, we do have it. So the best way to know when is the jellyfish blooming time, you can actually liaise with the CMAX that is under the USM. So they are actually in the process of developing a jellyfish grow apps. So basically, initially the trial phase is being done for the Penang Islands. So basically, you can download. I think the app is already ready for being downloaded. So you can see the times of jellyfish bloomings, the types of jellyfish that are available in the area.
Dr. Zaki, are you there, Dr. Zaki?
Hi, Anas.
Hi, Dr. Zaki. So maybe some want to know also regarding the commonly found species in Kelantan, Terengganu area.
Yeah, we just having a mild to moderate symptom. Patient come with a mild to moderate symptom. Basically, it's quite symptomatic, and then the usual specimen that we have is just Picelia species.
So next questions, probably Dr. Yvonne. Can vinegar be used for all jellyfish stings? And if vinegar is not available, can we use urine instead?
Okay, hi, Dr. Anas. Okay, thank you for the question. So can vinegar be used for all types of jellyfish? I would say not really, okay, but the most deadly jellyfish, which is the Chironex box jellyfish, okay, it is most effective to use the vinegar to deactivate those unfired nematocysts. So for example, others not so dangerous one, for example, the Phycelia species, okay, the blue bottle jellyfish, if we use vinegar, it can actually increase the discharge, but it is the Phycelia sting will not cause life-threatening problem. So that's why if in doubt, you still use vinegar lah. So for Phycelia species, actually the best thing is warm water.
Okay, thanks, Dr. Yvonne. So extension to that question, is there any period where people can still pour the vinegar onto the jellyfish sting site?
Whether there's any period or not, I will say as soon as possible if you're able to get the vinegar or 5% acetic acid. Because we do not know whether all the nematocysts has been discharged or not. Yeah, so just catch hold of the time and just pour and apply as much as vinegar you can for about 30, at least for 30 seconds.
Okay, thank you, Dr. Yvonne. So I guess back to Dr. Naim, is it true that some jellyfish species can go into freshwater area?
Right.
Have you encountered before?
Right. So the thing is that it is quite rare for jellyfish to be in the fresh water. I think there's about 1 or 2 species that can survive the fresh water, but it's not in Malaysia so far. Yeah. But during the breeding season, like the box jellyfish, they will kind go to an area that is less salty, like in the estuary place for breeding. Yeah.
So, okay, this is an interesting question. I think I will open to all panelists and presenter. Is compartment syndrome is common and is it considered as one of the complications from jellyfish sting? And what is the best approach if having so? What do you think, Dr. Naim, regarding compartment syndrome?
Okay, the thing is that I think we tend to overdiagnose compartment syndromes. So based on when you see that the slim are swelling, so you just like straightly label them as a compartment syndrome. But it can occur, but it requires a more objective measures. For example, like doing the Doppler ultrasound of the artery, or measuring the intra-compartment measuring. Because most of the time the swelling from the jellyfish stings are due to the venom effects. It is a cytotoxic, it can cause edema, so the swelling might look bad. And the second thing, it can be due, after some time, it can be due to the secondary bacterial infections as well. So first of all, you need to get the diagnosis right, whether it is a compartment or not. So my recommendation is that the best approach is to confirm the diagnosis first. Get the Doppler ultrasounds, or measure the intra-compartment measures. And the next thing is whether you can release the compartment or not is based on your findings. The next thing is whether we can use antivenom to improve it. Is kind of like controversial. Like for the snake bite cases, if you have like a swelling very big there, you need to optimize the antivenom. But for the jellyfish, there is not much data to support whether the antivenom can help with the excessive swelling that can cause compartment syndrome or not. So I think that the thing is that is need to look at the cases from the case-to-case basis, and there are a few things that we need to consider on how to approach these things.
Okay, thank you, Naim. So as for up to date, we have never encountered any compartment syndrome in jellyfish and venoming, and we do not expect so. However, if you suspect so, we can always incorporate our point of care ultrasound. But now for your information, we have a point of care ultrasound in local envenoming syndrome, or what we call POLES. Okay, so that can give you a better picture how deep is the swelling, and whether there is any acute compartment syndrome is actually happening or not. Okay. All right. I also received a few questions directed to me. Probably I'll get Dr. Zaki to give an input. Whether does all jellyfish sting needs admissions, or is it sufficient for us to observe for a short while in emergency department?
Right, thank you, Anas. All right, for jellyfish sting, is a rapid identification. So we must know the species and the symptoms and sign that patient suffered, whether it's mild, moderate, or severe envenoming. That's why from that 2 points, most probably you can decide whether this patient can be discharged or must be admitted for observation, or we must start the treatment and admit patient to the ICU. So it's based on our assessment, initial assessment. So there is a rules for the observation in emergency department if patient is asymptomatic, and then we identify the species is not cause harmful to that person, so we can observe. If you have an observation ward in your emergency department and your emergency department is not very busy that day.
Okay, thank you, Dr. Zaki. Just before we proceed with more questions, for all participants or attendees, there will be an e-cert for this webinar. So kindly fill up the forms which is attached in the chat box. Yeah. Okay. So the next question would be whether is there any role of hot compression or even cold compression in jellyfish stings? May I get Dr. Yvonne maybe to give an input?
Okay, Dr. Anas, thank you. So, so as we know, the first aid for jellyfish sting is always apply vinegar. So the vinegar can not only it stop the unfired nematocysts from being activated or firing, it also can help to reduce the symptom of pain. All right. So for pain, we use opioids. Okay. Then whether the hot water immersion or cold compression is useful or not, I would say is controversial. Yeah. But first thing is still you apply the vinegar and knowing that it is like a burn wound, so it's raw area. So if raw area you apply heat some more, actually it can actually cause more pain to me. So you can actually apply cold compression. Yeah. And another thing that I would like to highlight is before you want to take the nematocyst sampling, just now Dr. Jack Naim got explained that we have to apply the cellophane tape on the wound. Okay, before you do that, because any pressure to the sting site, it can actually cause the firing of nematocysts. So it's very important that you apply the vinegar prior to that. Okay. Do I answer your question?
Yes, Dr. Iwan. So again, this is a controversial thing, but yep, first aid, correct first aid in bites and sting and envenoming cases are really important. Okay. So Dr. Zaki, any specific advice for pre-hospital care regarding patient who is suspected to be stung by jellyfish?
All right, thank you. For the pre-hospital care, usually we are doing a standby for the events, which is involving the marine, such as Ocean Man, Swimmerton, Ironman. So we have to get prepared for the jellyfish thing. All right. So all the paramedic must be educated on how to identify and manage. And then we also can have a lidnokin spray, which can be used as a deactivate of the nematocysts and also as a painkiller at the same time, which is better for the pre-hospital care responder compared to the public first aider. Right. Thank you.
Okay, thank you, Dr. Zaki. So, but rule number one, please don't panic. Okay, in the event of being stung by jellyfish, keep the patient calm and bring to the nearest healthcare, especially hospital, as soon as possible. Okay, there is one, maybe we accept another one or two final questions since we are actually running out of time. Dr. Naim, there is a question to you. Any role of commercially available treatment for first aid, like for example, a spray or a sting no more, maybe a gel, especially maybe from the overseas, usually we see.
Right. So the thing is that when we are suggesting a first aid treatment, I would prefer to suggest something that is easily available to the patients, and sometimes we need to consider about the cost effectiveness. Yes, there are some study that being done whether the product is effective or not. So basically, we need to look at the profile of the product itself, whether it has gone through the study or not. Because as I mentioned before, different species of jellyfish, they react differently to the first aid modalities, right? So if you do not have anything, for me, that I will recommend that you just rinse it with the sea waters, actually. So I'm not here to promote any products. I do not want to promote because maybe for some reasons, but you have to look at the profile. But if you look at the study, yes, there are some products that are being mentioned in the question earlier that undergone some clinical trials. But my stand is that let me just recommend something that is cheap and easily available first. Not all can afford to buy those creams and everything, and not all the product works as well. Right.
Thank you, Dr. Naim. All right, so I think we have come to the end of the webinar for today. So before we end, just want to promote two upcoming events. Number one, this Friday we're gonna have, if you can see from in the chat box, posted by Prof. Dr. Ahmad Khaldun, we're gonna have clinical toxinology webinar, volume 3 for this year. Is it relevant for medical students? Okay, so do join us, do register, and as you can see on the screen now is a Northern Region Clinical Toxinology Symposium, which is gonna be somewhere early of next month. So it'll be conducted in Hospital Sungai Petani. So there are not many seats more left. So do register and maybe see you in July. Okay. So I think with that, I thank everyone. Thank you, Dr. Naim, the speaker, and all the expert panelists for taking your time to be with us this afternoon. So we're gonna see again maybe in August for the next clinical toxinology webinar. With that, thank you very much. Do not forget to click for the e-cert certifications. Thank you. Assalamualaikum.